Hello, 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 hello. Good evening. Good evening to all of us. Yes, this is Time with Dr. Cheme, and we are here once again to give you some fillers and tips that will help you in your poultry farm. So, kindly share and let other people also join because this particular topic we are about to treat today, I think it is one of the diseases that worry a lot of farmers in Ghana. Yes, so kindly share it and let people also join so that because normally we've been receiving a lot of calls that uh, my bed is blind, my bed is having this issue with the eye and all that. So today, doctor himself is here to give us everything you know to prevent it and also when it comes, how we'll be able to treat it on our farm. Yeah, so I want us to increase the numbers so that we can start. Currently, we have just about three people. Let's share it and let people join. So we are sharing them on the Ubuntu Farms training page so that those that are eager to join will join. Yeah, so we are waiting for others to join. Because we've been receiving calls. It's too much. I think we all need to prevent this particular illness on our farm. So bear with us. We'll start very soon. We want the numbers to increase so that doctor will not be going over after finishing the presentation. Okay, so the numbers are coming in now. Okay, Doc. I think the rest will join us, but for now, I think we can start. So we are looking at uh, infectious coryza today. We are looking at infectious coryza. So without wasting my time, I will just give the podium to questions. Then, and afterwards, we'll come in with the questions. Okay, so as you are following, if you have any question, just type it in the comment section. Or if you are in the WhatsApp group as well, you can also type in your question on the WhatsApp group. But you can anywhere you type it, we will see it and let Doc know so that he can answer your question. So Doc, over to you.
All right. Hello and good evening, everyone. You are all welcome to another session of Time with Dr. Treme. Last week, we began our series on bacterial infections. We had already treated some viral infections and then we came to the bacterial infections. And we began with E. coli last week, our last meeting. Today, we are going to talk about a very common bacterial infection that almost every farmer has heard about or has experienced it on their farm to some extent, and that is infectious coryza. And just as we always do, we are going to see or go through the disease itself, how the disease is transmitted on the farm, how we can identify the disease, how we can treat the disease, how to control and then prevent the infection when it gets on our farm, and then a few general recommendations that will help us or guide us whenever we have this infection occurring on our farm. So, infectious coryza. This particular infection is a bacterial infection which is characterized by respiratory signs. Okay, people only see the swelling and then they think, oh, when they see just the swelling, it is coryza. However, this particular infection is associated with some respiratory signs. It is primarily a respiratory infection, okay, and it is caused by the bacterium over there, Avibacterium paragallinarum. That's the name of the bacteria that causes this particular infection. And the signs that we all know are the facial swelling, there's nasal discharges also, but usually people don't really focus or see that one. And then there's sneezing. So the normal respiratory signs that we all see. So there are instances where you only see the respiratory signs and then people will just assume, oh, this one is CRD, CRD, CRD. But it might not be CRD. So today we are going to know more about this particular infection. And this infection in laying birds, it affects egg production. You realize that the production sometimes goes down, and then there are economic losses since once your egg production goes down, you'll not be able to meet your sales target and you'll be losing money. And this particular infection is highly contagious. So it spreads fast and it spreads rapidly. So before you notice, it's already widespread in the pen. So once you are not careful with your biosecurity, once the infection enters the farm, it spread very fast like wildfire. This particular infection has a very high morbidity. Morbidity means um, the animals or your bird showing signs of illness. So you can get a very high percentage of the birds coming down with the infection in a very short period. So you notice that maybe the first day you notice one, you even isolate or separate it from the pen. However, the following day, you realize about two or three more are also suffering from the same infection. You separate them, and then after 2 or 3 days, about 10% of your birds are all showing the signs of this infection. So it spreads very, very fast. And even after the birds have recovered from this particular infection, they still remain carriers. Carrier means the the infection might not be showing signs in them, but they are still shedding the pathogen in the environment. It is not causing illness in them, but they still shed the pathogen in the environment. So if you are not careful, even though you are done with your treatment, you'll still be getting more outbreak, because after the bears recovered, they still remain carriers, and then the pathogens were still being shed in the environment. And then there's economic losses, because first of all, you are losing money with regards to egg production, especially in the laying birds. Once the production goes down, you will not be able to meet your sales targets. And then even when they become spent layers and you want to dispose them off or sell them off, once the swelling or those signs of diseases are on the face, anytime someone comes in there to buy any of your birds, once he sees that sign, he will just automatically say the birds are sick, and they will not like to give you premium price for the birds that you are trying to sell off. They will end up giving you their own price, since outright they'll tell you that the birds are already sick. So the farmer tends to lose money once this infection enters the farm. As I stated earlier, this infection is caused by the bacteria called Abibacterium paragallinarum, and then the transmission is primarily through direct contact. So the affected animals or the affected birds spread it directly from themselves to other animals, and then since there are discharges through the nose and then the mouth, it serves as a means by which the pathogens are spread. So there are, when let's say there are nasal discharges, the animal goes to eat, some of the discharges fall into the feed, another bird picks it up, then that's how the pathogen or the infection keeps on spreading. So before you notice, you realize that a significant number of your birds are already showing signs. So we need to be very careful about this particular infection, and then ensure that our biosecurity is always on point. So it's a bacterial infection and it spreads quite easily. How is this particular infection presented? How do we notice this particular infection? The most common sign that we all know is the facial swelling. Once any farmer notices some form of swelling on the face, immediately that farmer will tell you, "Oh, my birds are suffering from Coryza." However, we've discussed and then we've noticed that some other infections can also cause some form of swelling in there. So the hallmark or the main sign to identify this particular bacterial infection is the facial swelling. Okay. So if you see the image on the right side, it is trying to show us how we can identify this infection or how this infection is presented. So because apart from the swelling that we've mentioned, the animal will be sneezing or there will be nasal discharges. Okay. I stated earlier that it is a respiratory infection. Even though we all noticed or we only use the swelling as the main sign to identify, it is primarily a respiratory infection. And then you notice that under the eyes or in the eyes too, there will be some form of fluid coming out. There will be discharges from the eyes. There will be difficulty in breathing, head shaking, gurgling. They'll be making that noise with their throat or in their throat. And then in laying birds, you can get the decreased egg production. So the main presentation or how we can identify this particular infection is through the facial swelling. So as I stated earlier, how can we identify this infection on our farm? You, the farmer, when you enter your pen, how will you be able to identify? What are the signs that will guide you to help identify this particular infection? The first one is the respiratory signs. So it's not always that when you go into the pen, you see some of these respiratory signs, the sneezing, the coughing, the nasal discharges, and automatically assume that is CRD. Today we are learning that even this infection called infectious coryza can present as the respiratory infections or CRD. The next one is the facial swelling. So you have swelling around the eyes, swelling in the infraorbital sinuses, swelling of the sinuses, swelling of the wattles, the red thing that you see. Sometimes that gets swollen. In laying birds, you notice there's dullness, there's loss of appetite, and then a drop in egg production. And since this infection brings down the immune system of the animals, it allows or opens the door for other infections to come in. So you can have secondary infections also occurring in this particular infection. So you notice that maybe even though the primary infection might be infectious coryza, other pathogens can end up affecting the animals also. So usually when you go to, let's say, the lab for PM, sometimes they'll tell you that, oh, there's probably infection going on. There's both coryza and then maybe salmonella occurring, the coryza or maybe pasteurella or something. Okay, so don't be surprised when you get mixed infections occasionally when you go to the lab. So these are some pictures showing the common signs that we all know of. So in all these pictures, you can notice the swelling around the eyes, below the eyes, and then in the image on the left side, down bottom left side, you realize that there's some mucus or fluid coming out from the nostril of the bird there. As I stated, you get nasal discharges or respiratory signs. So that's what that image there is trying to show us. Now, how do we treat this infection? It is a bacterial infection, so our primary way of treatment is the use of antibiotics. Okay. However, always consult your vet. As I stated earlier, it is very easy for you to confuse this infection with other infections or other bacterial infections because CRD will also present to you as these respiratory signs. So always consult your vet. Once you speak to him, if there are any mortalities, he will go ahead and then perform some postmortem and then try to find out the cause of the mortality. If it is this particular infection, he will recommend the best antibiotic of choice for you. Now, the next point I've written there, do not expect the swelling to disappear overnight. So I get this complaint all the time at my end. Farmers come in and then they say, oh, my birds have coryza. I went to Frankerson, they gave me a drug, it didn't work. And then I went to Medivet, they gave me a drug, it didn't work. They end up going to about 3-4 places, use multiple drugs, and then they say it didn't work. However, that's not the case in this particular infection. Once you give the antibiotic, it's not that automatically once you are done, the swelling will disappear from the eyes. Your duty is to ensure that you've done just as the vet or the technician has told you. So if the technician tells you to use this antibiotic, you go ahead and use it. But don't expect the swelling to disappear. Oh, the vet told me to use this drug. I did it for 5 days. after the 5 days, still the animals are suffering from the infection. No, it doesn't work that way. You have to separate the animals and then you do the treatment just as your vet has recommended. But it won't disappear after the 5 days or whenever you are done with the treatment. So it might take 2 months, months until the body itself absorbs the pus in there or whatever is causing the swelling away from there. The swelling will not go. Okay. So please, when you are done with your treatment, don't say that, oh, it didn't work. It has already worked, just that it is left to the body itself to absorb the pus or the whatever was causing the swelling from there. And it takes a long time. Okay, so don't end up using multiple drugs. Oh, and then my farmer friend said, let me use this drug, let me use this drug. You end up overdosing the animals or just wasting too much money. Yours is to just separate the animals and do the treatment as recommended. It is very important. Okay, because you most of these farmers they do the treatment, it doesn't go, and then they just go about saying, oh, the drug that a particular vet gave me is not good, so it didn't work. So we should be mindful of that. Okay, and then how do we prevent or control this infection when it gets onto the farm? How do we prevent or control? I've stated earlier that the treatment is by antibiotics. Okay, your treatment is by antibiotics. However, with regards to prevention and control, your main goal is or your main aim is through biosecurity. Once you're able to enforce your biosecurity as best as you can, you reduce the chances of infections coming on your farm. So always ensure proper biosecurity, strict biosecurity measures on your farm. Use the right disinfectant on your farm at the right dosages. Don't say, oh, the items are getting too expensive. So if you are supposed to use, let's say, 5 ml to 15 or 20 liters, you just use 5 ml in about 50 liters. No, you are diluting the disinfectant and you might not achieve the desired results after you have applied it. Okay, so your main way to prevent this infection is through biosecurity. You implement strict hygiene on your farm, have biosecurity protocols in place. So once you put these things in place, it will reduce the chances of pathogens getting on your farm. There are vaccines available for this, but it's not widely accepted. So apart from your main Newcastle that you do, there's also vaccine for this one. I think some of them is polyvalent. So in the third Newcastle, you can have some of the third Newcastle that has infectious coryza in it, and then there's some too that has infectious coryza and then salmonella in it. Yes. So when you notice that probably over the years you've encountered several cases of infectious coryza happening at your place, you can add the vaccination to your own chart. So this will be a personalized chart for you. You consult your vet and you describe to him or let him know that over the years you've been having recurring cases of the infectious coryza. So you want to add it to your vaccination chart, and he will find the best way to include it into your chart for you. But when you go to a person farm, you are not having that case over there. But because someone is doing it, you also want to do it. No, you end up rather introducing the infection onto your farm. So please, so this one has to be a personalized addition. You don't just go and add it because your farmer friend told you that he's doing it, so you also want to do it. No. Okay. So if there's no need for you to do the infectious coryza vaccination, don't bother doing it until you begin to get severe cases or recurring cases of the infection on your farm. Next is through environmental management. As I stated, this pathogen thrives well in the environment. So if you are not maintaining proper hygiene on your environment, you increase the chances of these pathogens existing and then proliferating on your farming space or in the environment there. So once the immune system of the animal goes down, they will easily pick up the pathogens and then the infection will end up occurring. So ensure proper hygiene, maintain good litter conditions. So you realize, oh, your litter is becoming dirty, it's becoming compact. Immediately you change it. You realize it's beginning to form balls on the feet of the bears. That's a sign for you to change it. Okay. So that's one sign that helps you to notice that probably your litter is beginning to go back. When you realize that it has formed balls around the legs of your bears. And the next one is veterinary consultation. Please consult your vet whenever you notice these signs on your farm. Okay. As I stated earlier, your vet will be able to adequately diagnose and then differentiate between other infections that might present itself in this same way. So if you don't consult your vet and then you just assume, oh, there's swelling, so it's coryza. I've told you earlier on that other infections can also present in the same way. So always consult your vet and then he'll be able to diagnose and then offer you proper treatment or management strategies. Today's presentation has been very short. Let's go on to some general recommendations as we always do. Since this pathogen thrives in the environment, ensure proper disinfection before, during, and then after, and then put in place very good management practices. Dispose of your carcass or your litter properly, else they become breeding grounds or residues, substrates that are good enough for the proliferation of the pathogens. And then, most importantly, do not expect the swelling to disappear overnight. No. And then once the swelling is still there, it doesn't mean that whatever treatment you did didn't work. No. Once the swelling does not disappear after you are done with the treatment, it doesn't mean the swelling or the treatment that you did didn't work. Okay. So I'm giving us a short summary of everything that we've done today. So today we discussed infectious coryza, and then we stated that this is a bacterial infection, and then it is characterized by facial swelling, nasal discharges, and then sneezing. Those are your normal respiratory signs that we all know of, and hence it is very easy for you to confuse it with other diseases or infections that may present as these respiratory signs. This infection in laying birds affects their production. So you tend to have drop in egg production once this infection occurs on your farm. And then it is very contagious. So it spreads very quickly. It spreads very quickly once it enters your farm. So before you say Jack, you have 10 to 20% of your birds showing signs of the infection on your farm. But once you notice that there's the infection going on, immediately separate the birds that are showing those signs, consult your vet, and then do as he says with regards to the treatment protocols he offers you. There's very high morbidity, so this infection spreads very quickly and then fast, but the mortality rate is quite low. And then even after the birds have recovered, they tend to become carriers. So the birds might have recovered from the infection, but they might still be spreading the pathogen in the environment. In the environment. Also, there are economic losses. This is because in laying birds, your production goes down, and then once you are losing eggs, you are losing money. Secondly, because of the swelling that occurs, buyers of spent layers might not like to offer premium price to purchase your birds. They might end up reducing the price, saying the birds are sick, so they might not want to buy them. And then this infection is caused by bacteria, as I stated, and then it's transmitted in the environment. So through direct contact, when the pathogens are being spread through the nasal discharges, the ocular discharges, it is spread into the environment, and then the animals around or the birds around also pick up the pathogens and they become infected. And then the most common sign that we use in identify this infection is the swelling. So you get the facial swelling around the eyes, in the infraorbital sinuses, in the wattles themselves, and then because there are discharges, you'll be getting those respiratory signs, the sneezing, the coughing, the wheezing. You'll be noticing those signs in your birds. And then in laying birds, there will be drop in production. So these are some of the ways we use to identify this infection. You notice the respiratory signs, you notice the most common ones, the facial swelling, and then you get the reduced egg production in laying birds. And then it opens the door for other infections to also come in. So there is the high possibility of other bacterial infections or secondary infections also affecting your birds. So in this image, we can see some of the pictures of birds showing this particular infection we are talking about. So you notice that in all the images, there is swelling around the eyes and then in the infraorbital sinuses. And then in this particular image, you notice the discharges from the nostrils. The one in the bottom left corner, there is some discharge in the nostrils. And so our main way of treating this particular infection is the use of antibiotics. However, consult your vet before you give any antibiotic. Okay, consult your vet before you give any antibiotic. But the main treatment for this infection is antibiotics. And then, most importantly, do not expect the swelling to disappear overnight because it won't. So, when you notice that, don't say whatever medication your vet gave you didn't work. No, because the swelling does not disappear overnight. It is until the body itself has been able to absorb everything, that's when it will disappear. And then, by means of prevention and control, we stated that we will be controlling or preventing this infection from entering our farm through biosecurity measures. So you ensure proper hygiene, proper sanitation, regular disinfection and cleaning of your equipment. All these help to reduce and then mitigate the chances of the infection coming on your farm. And then I stated that currently there are vaccines available on the market that you can add to your vaccination schedule. However, consult your vet first because it is not a primary vaccination that we do. So until there's a need for it, there's no need for you to do it. Wait and consult your vet first. And then once you are able to maintain or manage your environment adequately, you reduce the chances of the infection occurring on your farm because, as I stated, the pathogens are being shared by the animals day in, day out, even after you are done with your treatment, since they've become carriers now. So if you are not regularly maintaining or managing your environment, you end up propagating the pathogens in there, and then the infection will continue to occur or recur on the farm. And then always consult your vet. All right, so I'll end it here, and then if there are any questions, the floor is open. Please, Da Costa, if there are any
Yeah,
questions
Doc.
from your
Yeah,
end,
so
let
already
us.
questions are coming in, but I want to also put this across. If you want to join in to ask your question, let's say you want to just come and ask yours orally without typing it, you can join using this link. Yeah, I've put the link on the comment section. So you can join through that link and you come on live. So you come on live to ask your question. But let's ask, I want to check on those that have already typed yes. So one person said he has been treating infectious coryza for 2 weeks now. Still no show. He hasn't seen any better changes, and he has used different medications. So he doesn't even know what medicine to use again. So that's the question. And he also said, please will tetracolivate solve infectious coryza. He also added that.
All right. So that's the point I've been making and then I've been stressing on. Whatever you give, the swelling will not disappear overnight. If you were told to give it for 5 days, when you are done with the 5 days, it will not disappear. No. Okay. So it doesn't mean that the treatment didn't work, but it is now left to the body itself to absorb the pus over there. Yours was to give your antibiotic or the tetracolivate that you used, and then you are done. Just separate the animals from the main pen so that you reduce the chances of the infection being spread to the other animals. However, the swelling that you noticed will not disappear. So I think it's high time we the vets communicated some of these things to you, because usually when you go, they'll just give you this particular product and tell you, oh, it works very well. And then the farmer will go and use it, expecting that once he is done, everything will disappear. No. So today I'm telling you that whatever treatment that you did is okay. Once you followed the right dosage and everything that the vet or whoever gave it to you told you to do, that's enough. Just ensure that you've isolated or separated those particular bears, and then you've done the treatment for all the bears. However, the swelling will not disappear. The body itself will try to absorb everything back, but until it is done, everything will not live there. Okay, so put that in your head whenever you are doing that. So locally or most of the farmers themselves, they try to push the pass from under the eyes. Okay, people do that.
Yeah, I was about to ask that question. That
Yes,
can
people do
you,
that.
yeah, can you do that as well?
Yes. So you at that level, you can do that, but medically, it's not supposed to that. I'm not supposed to do that. But people are always worried when they see that over there. So
No.
it doesn't kill the bird. There's a high morbidity rate. Morbidity means falling ill. So other animals can easily pick it up, but It is very in very rare cases will the animals die directly from infectious coryza. But I've told you that you can have secondary bacterial infections also occurring. So other infections can come in and then that might cause mortality. But it is very rare from the for the animals themselves to die directly from this particular infection. Okay. So most of the farmers do that since they are worried and then they always want to do something. You are not supposed to, but you people do that. I will not take that away from you, but it is very painful and then stressful to the animal. You are not supposed to be doing that, but you tend to do that, and then it helps you. So yes, you can do that, but medically or professionally, that's not supposed to be done like that, and then not by
But
how you guys do it. I know someone who uses broomsticks, and then they'll catch the bird.
cotton bud,
Yeah, usually when we are
cotton
doing it,
bud.
we do it under sterile conditions, just like we may be performing surgery at the lab or at the clinic. You do it under sterile conditions. You don't just cut the animal and then you cut, or some of them just push it out. You yourself, when you have a ball and then you press it, it's very painful for you. But you just cut the bed and then you be pressing some of these things out of their eyes. Okay, so that's not really recommended. However, back to the main question. Yes, you've been treating it for 2 weeks. Once you did the first 1 week, the treatment is okay. This is because you were expecting it to disappear, but no, it doesn't work that way.
Okay.
Until the body is able to absorb everything, you continue to see the swelling over there. Okay, so it's not that I see that you've written still haven't seen any better changes. Yes, you notice any better changes. No, you will not notice. The swelling will continue to be there until the body itself absorbs everything from there. All right, Acosta, next
But
question.
Doc,
Uh-huh.
will it go?
Yes, it will go. That's what I'm saying, that it will take a long time. I
Okay.
can't give you a phase period, but it will take months
Okay.
before it is completely gone. Okay.
Okay. Thank you. Yes. And so what about, because someone is also asking, is you see the first person asked whether the trapolivids can work with it, or someone is also asking, is tylosin good for coryza? And someone is also saying, so what type of antibiotics is best to use? So it's like
Okay.
everybody wants like the best one to use for coryza. But
Okay.
I
So
saw in your presentation that like uh, any antibiotics, especially Enrovet. What
yeah.
does the Enrovet has that can help solve this particular problem?
Okay. So Aerovet is one of the good broad spectrum antibiotics. So you see that I stated that this particular infection is a gram negative. There's no need for me to worry you with that one, but it's a bacterial infection, okay?
Okay.
And then you need a broad spectrum antibiotic that will be able to have, cause or bring healing to the animal. The properties of enrofloxacin is that, or Enrovet is that, it is very good for the GIT and the respiratory tract. Okay,
Okay.
so in the earlier presentation, as I was talking, I said that it is a respiratory infection. So if you see here, I think the first one, yes, it is an acute bacterial respiratory disease. So drugs like enrofloxacin and then tylosin are very good for respiratory disease. This is because they work directly on the respiratory tract and then the alimentary canal or the digestive tract. Okay,
Okay.
so drugs like enrofloxacin and then tylosin are good. But I'm saying that you people, the way you guys are asking, even though that's the best drug of choice, that doesn't mean once you use it, the infection will disappear. Please know that that's the most important thing. If I give you the strongest antibiotic in the world, after using it, it will not disappear from the eyes. The swelling will not disappear. That's the most important thing. Once you know that, you are fine. Okay. Yours is to make sure that you've given the antibiotics that was recommended to you by the vet. Usually to be tylosin based or doxycycline based or fluoxetine based. This is because these antibiotics are good for the respiratory and then the alimentary canal. Other than that, it will not disappear. Okay. But with regards to the best drug of choice, any drug that affects directly or works directly on the alimentary canal or the respiratory tract is your drug of choice. Please, next question.
So,
Please, are
so
we
doc,
okay?
yeah, we are okay. So, doc, I'm also asking. Let's say, uh, because we've been practicing, is even today that you've made us understand that it's not really advisable to cut open or just use broom or whatever to remove that white substance. So, let's say after doing that, can you give the best pen strip?
Yes, we can do that. So pen strip is also a broad spectrum antibiotic.
Okay.
Okay, that's why I left it general that you give them antibiotics. So pen strip is
Okay.
also a very good antibiotic that you can use.
Okay.
Okay.
So, uh, another person is asking, so please, after treating them for 1 week, should we add them to their fellow flocks or we should maintain them at the
No, don't add them. Don't add them. Continue to separate them from the main flock. Okay.
okay.
That's the issue because with the other infections, even though they'll be carriers, they tend to recover and then you are easily able to send them back. But these ones, it will take a long time for you to notice that the swelling has gone down. But once you realize that the animals are doing fine, they are active, so you don't bring them back immediately after you've done the treatment. No. Usually when you do treatment, you have to wait about 2 weeks to ensure that everything has or the animal has recovered. So let's say you can keep them there for about 2 to 4 weeks, and then afterwards you can send them back to the main flock. But just know that even by that time, the swelling would not have gone down, and that doesn't mean your antibiotic you give it didn't work. Okay.
Okay. And someone is also asking, say, my beds are showing some symptoms. I am suspecting Coryza and I lost a bed today. What should I do to avoid further death?
All right. So all the birds that are showing the signs of infection, you have to separate them from the pen so that you reduce the chances of the infection spreading. I'm not saying it is coryza, but whatever infection is there, separate the birds that are showing signs of the infection. And then the carcass that you have there, if you kept it, you can send it to the vet. So I don't know where you are. So the closest veterinary hospital or clinic nearest to you can send the carcass there for postmortem so that they will be able to diagnose properly for you the exact infection. You see that I stated earlier that it is very easy for you to mistake this infection with other infections. So to be on the safe side, make sure you send the carcass to the veterinary clinic for them to confirm for you. But in the meantime, you separate the birds that are showing the signs of illness. They are showing dullness, they are not active, there's swelling on their face. You can separate them. But if you are not, let's say you are not hearing from the vet, and then at least as a first aid measure, I told you that we treat with antibiotics. So you can start the antibiotics whilst you send the carcass to them. So that to be on the safe side, you might have started something. So by the time you get the results, if there's a need for you to change whatever you are giving them, the vet will let you know. Okay.
Okay. And someone also asked that, does the ammonia in the manure affect the birds to get Coryza?
Yeah. So indirectly you can have that occurring, but this is a pathogen that is causing this infection. Okay. So the ammonia there might bring down the immune system of the birds. So that's how come you end up getting the as I said, you can get make the infection occurring. So the ammonia makes it difficult for the birds to breathe, and then you can have the immune system coming down. So once the immune system goes down like that, it is easy for the pathogen to now come and cause infection. So you realize that most farmers will tell you that once you have ammonia buildup, you end up getting coryza. But there's no direct link like that. But because the immune system of the birds goes down, then the pathogen then begins to cause infection in there. Okay. So you can have that
Okay.
occurring since the immune system of the birds has gone down.
Okay. Okay. I think these are all the questions that came to. Yes. Um, as I go through. Okay. So, Doc,
Yes, sir.
so I think some last questions has come. So someone is asking that, does does this disease kill the frog?
Mhm. So this disease, particular disease, has a high morbidity rate but a low mortality rate. Morbidity means it spreads easily, it is contagious, and it can spread easily over there. But for them to die directly from this infection, it is not really common. Okay. So you don't expect to have a lot of mortalities occurring directly. So I'm using the word directly from this infection. However, because their immune system goes down, another infection that can cause a lot of mortalities can also come in, and then you'll be getting mortalities. But they might not be dying directly from infectious coryza because it doesn't kill the birds like that, but it affects them, and then their production can go down.
So does it mean the first guy that said he has already lost the bed? Can it be that maybe there is other infections in there?
Yes, there's a
That's
possibility
yeah.
that there are other infections in there. Okay. Yes.
So someone is asking, after separating them, can you use the antibiotics for the remaining flock which have not shown any sign?
Exactly. Yes. So whenever we are doing treatment, we do the treatment for the entire flock. You don't only treat the animals that you separated because some of the birds in the main flock might have come in contact with the infection, but they are not showing signs yet. So if you don't begin the treatment, they will end up coming up with the infection and then be spreading it before you even notice. So whenever we are giving treatment, we don't treat only the isolated birds. No, you are supposed to treat all the birds together. Okay. So what you can usually do is maybe in the general flock, if you are supposed to do 5 days, you do the 5 days, but maybe in the affected birds, you end up doing 7 days. So you realize that on all your medications or all the drugs, it's written maybe 5 to 7 days, 3 to 5 days. So in the main flock that are not showing the signs, can use the lower limit, but the birds that are showing the signs that you've isolated can use the upper limit. Okay, so you are supposed to treat
Okay.
all the birds, not just the isolated birds.
So, Doc, sorry, if you say lower limits and upper limits, can you expatiate it?
Yes, so the lower limit that I'm saying is, so when you check on every drug, usually the number of days, the dosages, they'll tell you maybe treatment 100 mg to 200 liters, and then prevention 100 mg to, let's say, 400 liters of water. So you realize that when you are treating the animals is different from when you are preventing, the dosages that you are supposed to use, and then the number of days too. So the lower limit is, you see that the number of days, usually they've written 5 to 7 days. So the
Okay.
5 is the lower limit, and then 7 is the upper limit. So in the sick bears, the bears that are showing the signs, you can be using the upper limit, the 7 days, because you'll be doing other things for your bears also. You have to make sure that you don't put them on drugs for too long. So the bears that are not beginning to show signs, use the lower limit so that you get days to do the other things. So let's assume you have cowpox vaccination coming up, and then you are doing treatment, or in that week you have to do your cocci treatment too. So instead of you doing the full 7 days, you do the 7 days in the sick beds, but in your main flock, you do 5 days so that you get some days on plain water before you come and do your cocci. Okay. Else the
Okay.
animals would have been on drug continuously for a long time, and that is also not good for their liver.
Okay. So at what point can we give them liver detox?
Yes. So the periods when you can give them, that is one, when they've been on drugs consistently over a period. Okay. So realize that maybe in a particular stretch, in a particular set of weeks, maybe the animal fell ill, you did antibiotic treatment. When you finish, your vet told you to give them vitamins to help boost their immune systems more. And then afterwards, you were supposed to do your toxic treatment. You did that one, and then the animals were stressed, so you were supposed to give them some anti-stress afterwards. So realize that for about 3 weeks continuously,
They've
they
been
had been
taking
on drugs.
medications.
Hence, the liver is being worked over time. So once you are done with all this drug administration, you can follow up with drugs like liver tonic, hepasol, heparol, to help detoxify the liver, because every drug that you give has to be metabolized by the liver, and then the liver, how the liver does it is it makes available the therapeutic ingredient, the active ingredient, whilst taking back whatever toxins may also be in there. So it kills the toxins, and then it brings out the the active ingredient so that the body can use that one. So you realize that the it becomes toxic, like it becomes overworked. So you need your detoxifier to come in and then help detoxify the liver. So that is one, when you've overused or put the animals on drugs for too long. And then secondly, when um, your carcass or your bears are getting fat. So when there's the case of, let's say, fatty hemorrhagic syndrome, for instance, you need to detoxify the liver, because it is the liver that is working on the fat, converting all um, the excess food that the animal has consumed into fat. And it is the same liver too that has to melt down the fat and then bring it down. So it means it is being worked over time. So you give in some of these liver enhancers so that it helps to bring down the fat to some extent, and then improve the liver activity also, because everything that the animal consumes is worked on by the liver. Okay.
Okay.
So in fatty cases, make sure you are giving them some liver enhancers or liver tonics, and then when they've been on drugs for too long, at least these are the two main periods when you need them. Um, Drugs like liver tonic, like that. Okay.
Okay. Okay. Okay. So uh, we are about wrapping up, and before we go, in fact, this particular program is being sponsored by two companies, Ubuntu Farms and Dukovet. Yes. So most of the medications that Doc is mentioning, in fact, we have them, like the liver tonic like this. So if you've been giving your best all these drugs and you've not detoxified them even once, you have to get some. Yes, and do the detoxification. And also the Enrovet, the Enrovet uh, for the antibiotic for treating Coryza. That one too, we have some. Okay, so you can contact us. See, the number is on the screen. Okay, so you can just contact us. And when you contact us, either in Kutu Farms or Dukovet, we will help you get some of these medications. Okay. So, Doc, thank you very much. I think there's this one last question, then we are done. Someone is asking that. So you mentioned that there are other diseases that have similar symptoms like that of the coryza, and I think the person wants to know which other diseases
Okay.
like that.
So as I stated, because this one presents as a respiratory disease, diseases like CRD, you can get these nasal discharges in there. So you might confuse it with CRD. And then the
Okay,
respiratory aspect of Newcastle. When we're discussing Newcastle, I told you that it presents in
yes,
three main forms. So you can get it occurring in the respiratory pathway. So if you're not careful, you'll be seeing some of these respiratory signs and then you think that it is this one. And then the swelling to in chronic cases of pasteurellosis, you can get the swelling over there. And then when we discussed fowl pox, we mentioned that
cowpox,
in
yeah,
the diphtheric pox, in the diphtheric form, you can get swelling in the infraorbital sinuses. So if you are not careful, you might still confuse it with um, this particular
correct.
infection, the infectious coryza. So we
Okay,
discussed earlier on Newcastle will give you the respiratory, Fowl-pox will give you the diphtheric form or the swelling in the infraorbital sinuses, and then CRD itself will also present as the respiratory sign that we all know, and then chronic pasteurellosis will also give you this same swelling that we've mentioned. Okay, the swelling in the infraorbital sinuses and then around the eyes. So you don't know pasteurellosis, so maybe later on when we discuss that one, you'll be able to identify how that infection also presents itself. Yeah,
okay, okay. No, thank you very much. Thank you. So, if you have any further questions, if you're on the WhatsApp platform or those that will be watching this live later on our YouTube and Facebook, if you have any other question, you can put it on the WhatsApp platform and we will attend to. Okay, so Doc, thank you once again. And
sure.
as we are
So
ending
you
this,
as a takeaway, please,
okay,
all the farmers have it at the back of your mind that once you are done with the treatment, the swelling will not disappear. It doesn't matter whatever antibiotic that you are using, the swelling will not disappear. So we end up confusing it and then saying that whatever drug that was given to us didn't work, but that's not the case. In the nature of the bacteria or this particular infection, it doesn't disappear until the body itself has been able to absorb it. All right, thank you.
Doc, Doc, thank you very much. Thank you. So See you next time when we come live. Okay. So the next topic will be communicated to us on the various platforms. Okay. Thank you.